As an ophthalmologist and a facial plastic surgeon, I've seen countless patients come in with concerns about a mysterious bump on their eyelid. Just like you, they wonder, is it serious? Will it go away on its own? This bump, known as a chalazion, can be both uncomfortable and worrying. In today's video, I'll share with you the most effective ways to identify and treat a chalazion based on my years of experience in this field. Chalazion is basically a blocked oil gland. What's interesting is the oil gland starts on the edge of your eyelid. So some people have a little bump on the end of their eyelid, which is called a stye. A stye is not a chalazion. A stye would be like the cork on a wine bottle. The chalazion would be like the bottle of wine and all the wine inside. They're together but different. So if you have a stye, you can use hot compresses, a clean needle, and just unroof it, and usually it drains on its own, and it never turns into a chalazion. If it blocks the oil gland and everything backs up, your body's constantly making oil to help lubricate and stabilize your tear film. But if it blocks and it gets into your tissues, your body sees it as a foreign material. Then it causes a foreign body reaction and it walls off this oil mass called a chalazion. That is the bump that you see and feel in your eyelid. When it gets to that point, antibiotics aren't going to do any good. You can either use heat early on, mostly for a stye. When it's starting to form a chalazion, you can get a steroid shot into your eyelid tissues that will kind of jumpstart your own immune system to help break it down. If that happens early, a lot of times it goes away. Once it walls off and it's like a little pea or a small almond in your eyelid, the only way to get rid of it is surgical. The good news is it is benign. It's not an emergency, but it's going to be disfiguring. It's going to bother you. And if it grows or it ruptures, then it's going to cause a lot of inflammation. So usually when people come see me, they've seen several other doctors. They've tried antibiotics, they've tried heat, they've tried all these things, but they haven't done a steroid injection and they haven't tried to remove it surgically. That's the only two things that work, is either heat early, a shot early, or surgery. That's it. There's no other magic to get rid of it.